Hi, everybody, and welcome. Today, we are talking about the role of supplements and osteoporosis and bone density, what to pay attention to, what to ignore, and how to really determine quality in those supplements you're choosing. Hi, I'm Dr. Lisa. I'm a physical therapist and a specialist in osteoporosis exercise and programming. And I'm a person with low bone density. So I understand how challenging it is to figure out what to really pay attention to. And while a balanced diet is essential, many people may not get enough key nutrients to maintain optimal bone health through food alone. Our bones require a symphony of nutrients for that continual remodeling and repair process that is always going on in the background for us. This is where targeted supplements can play a vital role in filling any gaps and providing support necessary for strong bones. Unfortunately, this market is often flooded with misleading information and products that may not provide any benefit at all or might in fact harm. So today I'm thrilled to have Dr. Jennifer Hahn, clinical pharmacist here, one of the Calcium Queens, founders of C Nutrition, to talk about evidence-based supplements that can genuinely benefit bone density, as well as guidance on how to locate high-quality sources of these products. By empowering ourselves with accurate information, you can make an informed choice to enhance your bone health journey. Dr. Jennifer Hahn, thank you for joining me again today. It's always wonderful to see you.
Thank you for having me, Lisa. I'm super excited for our talk today.
I love when you're here because I feel like we can get information that we can trust to help us make really good decisions for our bone health. And I know that this is not just professional for you, it's personal, isn't it?
Yeah, it's very personal. It's both. When I was diagnosed with osteoporosis at age 30 after fracturing my back, yes, I changed my professional expertise to really hone in on osteoporosis, but I'm also navigating that every single day, just as you are in your community. So we're all on the same journey here together.
Yes, we all have the goal to have strong bones, a confident body, and to remain fracture-free, right?
Yes.
Right. Okay. So we know that building strong bones can take more than one nutrient. It's a symphony of things that happen.
Mm-hmm.
What are some of the key nutrients that we really need to pay the most attention to?
Yes, it's important that we understand bone health comprehensively. We know that bone health, you need to eat right, you need to exercise, medications, if appropriate for you. And so in that same way, when we're looking at nutrients for bone health, you have to look at the whole spectrum. So the key nutrients for bone health are obviously calcium, vitamin D, magnesium, vitamin K2, protein, and we'll talk about some others. But when I'm thinking about bone health, those 5 nutrients are the 5 that I'm really focusing in on.
I love it. Yeah. So we want to know about the things that really move the needle the most, that make the biggest difference and have the most influence. And we do know, and we agree that a food first approach is the smartest, but it can be hard sometimes. And there are some times where we're not going to be able to hit all those notes. So what is hardest to obtain naturally in our diet?
Yeah, it's a good question. So we listed calcium, vitamin D, vitamin K2, magnesium, and protein. Which of these are hard to obtain in the diet and reach recommended values? It's actually all of them. And so we'll break it down as we go through this talk to really understand the data behind, in population studies, how many of us are deficient in this specific nutrient. But to give you a kind of a preview, it's actually all of them. So I want to give you actionable tips and tricks to really increase the content for all of those nutrients from food. And if you can't get it from food, then which supplements to look for.
Okay, I love the way you phrase that because one, we're saying that we struggle all the way around to get these key nutrients, and I hear people in my group talk about that, but it's not just anecdotal. You're talking about we have these studies that back up that in general these are the things that we are deficient in.
Yes, yeah.
All right. Well, let's start at the top with vitamin D. How important is the role in vitamin D when it comes to our bone health?
Vitamin D is one of the critical nutrients for bone health. I would say it's, if not the most, maybe the second most important. And it's important in this context because we're talking about what nutrient is hard to obtain in our diet or
Mhm.
in everyday life. Vitamin D is one of them. Most of the US population is deficient in vitamin D, especially during winter months, and especially if you're living in the Northeast, for example, where I am, where we're not seeing the sun for many months of the year.
Mhm.
So it would be a safe assumption to say that you should be looking at some sort of supplementation or really looking at vitamin D in your diet to make sure that you're getting enough. Why? Vitamin D is critical for calcium absorption. Vitamin D helps calcium transport from the gut to your blood, and then from the blood, it gets to your bones. So you could kind of think of it as like the carrier, right? So you're eating calcium, and then the vitamin D carries that calcium from your gut to your blood so that you can actually use that calcium appropriately. So that's the critical role of vitamin D in bone health.
If you want to absorb the calcium you're taking in, we need vitamin D for that process.
Yes.
Yes. All right. Are there different forms? Are some better than others?
Yeah, I really want to highlight this because we get this question a lot. There's vitamin D2, which is ergocalciferol, and then there's vitamin D3, which is cholecalciferol. These are two forms of vitamin D, right? Vitamin D3, cholecalciferol, is what we get from the sun, right? We're outside on the sun, and then our skin makes vitamin D endogenously. Vitamin D2 is present in some foods. So white button mushrooms, for example, when they're exposed to sun, they make vitamin D, but they make it in the form of vitamin D2. There's two forms of vitamin D2 or vitamin D, but it's important to know that once you consume either vitamin D2 or vitamin D3, your body has to metabolize it and convert it to the active form, which is
Okay.
calcitriol.
Okay.
Calcitriol is the form that's going to help calcium absorb into your body. So I hope that makes sense. It doesn't matter actually when we're thinking in the context of calcium absorption or bone health if you're getting vitamin D2 or D3. Either of those forms have to convert to calcitriol, the active form, in order to exert its benefits for bone health. So
Do they do that pretty equally, or is one more create more of that active agent better than the other?
well, when we're thinking about vitamin D in the context of calcium absorption, either is going to do that, right? Because both need to be converted to calcitriol. But when we're thinking about vitamin D as a standalone vitamin D supplement to increase vitamin D levels, then that's where the nuance between D2 and D3 come into play. Some research shows that vitamin D3 elevates your vitamin D levels in your blood a little bit faster and may sustain a little bit longer. So that's why a lot of folks supplement with vitamin D3. Completely fine. That would be appropriate if your goal is to increase your vitamin D levels. But when we're talking about calcium absorption, it doesn't matter if it's D2 or D3. So that's why some folks are like, I prefer to get it from food and not really take a supplement. Well, then you could focus in on the foods that contain vitamin D2 and rest assured that it will help your calcium absorption.
Love it. So if you're eating foods that have calcium and have vitamin D in the form of vitamin D2, that vitamin D2 will be converted to the active, what did you call it again?
Calcitriol.
Calcitriol. Thank you. It will be converted to calcitriol to help you absorb that calcium that you just ate. Marvelous. Okay. That's a great way to look at it. Do we know, are there optimal levels? Because my understanding is this is really individualized. Like some people can really have more optimal levels of vitamin D. Some people need more supplementation. I know it's really influenced by inflammation. So it isn't a one size fits all, is it?
No, it's not. So really the dose that you should consume is highly individualized, and it should be made with a shared decision conversation with your provider. You should get your vitamin D levels checked, see where you're at, and then your provider will recommend appropriate supplementation for you. It's unfortunate that there isn't like one target level number that we're all reaching for, but I've heard in different societies, for example, in the endocrine society, that a range of 20 to 40 would be safe. Like if you're in the 20 to 40 range, 20 to 50 range, it would be a safe level to be at. Nowadays in social media, sometimes I see some posts of people saying, take 10,000 international units of vitamin D. And I would say that's pretty excessive. And again, you have to look at, is it vitamin D2 or D3? Because the dosing between those are different as well.
Yeah. And when you're talking the testing, that's nanograms per milliliter. That's one of the common versions and units that are used in the United States. So one has to really verify which set of measurements are being looked at for that range. And then there are other factors as you work with your medical team to determine how much vitamin D you need, which is your test. We don't want it too high and we don't want it too low.
Yeah.
And then there may be other factors based on the medication you're taking, any bone medication, kidney stones, other things that your doctor may do an adjustment of the vitamin D based on that. So it really should be an individualized approach.
Yes. Yeah, for sure.
Okay. What do you look for in a brand? How do you know what quality to get?
Yeah. So if you're not eating enough vitamin D from your foods, which is most of us, right? We already talked about most of the population is deficient in vitamin D, and you're out in the market looking for a vitamin D supplement, these are some recommendations that I have. The first one is that you should look for a brand that has third-party testing. So there's third-party societies like the NSF, USP, Certified Laboratory. These are organizations that have been around for a very long time, and they test supplements to make sure that they are absent of heavy metals and of dangerous substances like microbes and things like that. If a supplement has this seal, like the NSF seal, the USP seal, it means that that supplement was made with good manufacturing practices to have to not really have the heavy metals and the microbes. But the seal doesn't actually mean that that supplement is effective. So it's a nuanced point, and I think it's very important because sometimes we think that seal means everything, but it doesn't mean that, for example, you pick up a calcium supplement, right? It's calcium carbonate, and it has that seal, that USP seal. That means that that calcium carbonate was made safe through safe manufacturing processes, but it doesn't mean that calcium carbonate is the best form of calcium to consume. No. So that's why it's important to understand what that seal actually means. So take it with a grain of salt. I think it's a great first line of defense in terms of navigating supplements, but it's not the one-stop thing to look for.
Okay, so that third-party testing talks about the quality of manufacturing, but not necessarily the effectiveness of the product.
Yeah, yes.
Got it. That was super helpful. Anything else we should consider there when it comes to searching out a quality vitamin D?
I think this is another kind of blanket statement for all supplements, is that supplements, there could be more than what you're looking for in that actual supplement. For example, vitamin D may be mixed with other things. So just be wary and cautious, and understand what you're consuming, because if you're taking a little bit of this supplement and a little bit of this, and then maybe a multivitamin, those things can add up, and it's important to know what you're consuming in totality.
I'm willing to bet as a pharmacist, you've seen that all too often. And I think we need to be super aware of our other protein drinks and other things that we're taking in and looking at those labels, because there are a lot of different things on there that can have a very additive effect on top of anything else we're supplementing. That's a really great point. Let's go to my favorite, magnesium. Ooh. Magnesium is my favorite.
Okay.
Why is magnesium important? What does that do for our bones?
Yeah, magnesium is important for a lot of things, but there's good data with magnesium and bone health, right? So magnesium kind of helps calcium and vitamin D indirectly. It serves as an essential cofactor for a lot of enzymatic reactions in our body that help that vitamin D and then thereby help that calcium. So there's good evidence for magnesium. There's also evidence that shows that if you're low on magnesium, with which 50% of the population is, it could increase inflammation in your body. And we know that if you have increased inflammation, then that could be also harmful to your bones.
Mhm.
So there's a lot of different ways to look at why magnesium is important for bone health and why we should pay attention to maybe increasing foods that we eat that have magnesium. And if that's not enough, then consider supplementation.
I know magnesium has a role in so many of our physiological systems. Like
Yeah.
it is important. I started it to help with relaxation and sleep, nervous system calming. But the more I read about its role in bone health, I mean, it really is a factor. And controlling inflammation has
Mhm.
so many beneficial downstream effects.
Yes.
I think this is incredibly important. I don't see this as something that's regularly tested. Is there a way that we can kind of have an awareness of whether or not we might be deficient?
Well, when you get your blood tested, you can check for magnesium levels, but that's generally not how we understand magnesium deficiency. I think the appropriate way to be would be to look at your diet, look at
Mhm,
what you're consuming, and then kind of get a rough estimate of how much you're eating in your everyday diet, and
mhm,
then go from there. But
mm,
again, like population health data shows
mhm.
that about 50% of the Americans today are deficient in magnesium.
Are some forms better than others?
I think it really depends on what you're looking for in terms of that magnesium. There's so many different forms of magnesium out there. So just to list a few, there's magnesium oxide, magnesium citrate, magnesium threonate, magnesium glycinate. All of these, as you could tell, they have like magnesium plus something. So
Mhm,
magnesium is bound to something because that's how it's delivered to your body. And depending on what it's bound to, it can exert different benefits to your body. So, for example, magnesium glycinate, that's a popular magnesium used for stress, for anxiety, for relaxation. Because that magnesium is bound to glycinate, it increases the absorption of magnesium so that it could get to your brain easier.
mhm,
So I wouldn't say like one is better over the other, but it depends on what you're looking for with that magnesium.
mm.
So magnesium glycinate, magnesium threonate, those have great absorption to get to your brain to help with sleep and relaxation. Magnesium oxide or magnesium citrate is mainly used for constipation.
Mm.
So they just all kind of exert different benefits. So it depends what you're looking for in terms of that magnesium.
Correct me if I'm wrong. I think many of the studies, the more predominant source used in the studies was magnesium citrate.
Yeah, magnesium citrate and magnesium oxide, because that's just been like the standard form of magnesium used to study, especially in bone health and other things. But that doesn't mean that you have to take magnesium oxide because that's what was used in that study. It's the same thing when we're looking at calcium studies and bone health. They always use calcium carbonate because it's the most available, cheapest form. So that's what's used, but we know from like the pharmacokinetic mechanism of it that magnesium glycinate may be good if you're looking specifically for relaxation.
So, to help me understand, so there are different forms, they can have different benefits, but it's not really an on off switch. So, if somebody is taking the magnesium glycinate form as more of a relaxer at night for sleep, this still helps with their circulating magnesium and supporting their bones. It's not like an all or nothing. Having enough magnesium is still bone health supportive.
Yes, exactly. So it doesn't really, what form you take is up to you, but just because you take magnesium glycinate or magnesium oxide, that magnesium is going to still help your overall body functions, including your bone health.
Super. Are there recommended doses, or is that really variable? And is there an upper end limit where people should not exceed that dose?
Really, I think again, that's it really individualized. So I would, when you're looking at supplements, and again, this is a blanket recommendation for all supplements, is that when you pick up a magnesium bottle and you turn it around and look at the supplement facts, if the amount that it contains is over 100%, what that's telling you is that that supplement is not taking into account your diet. You will be consuming some magnesium through your food. So it would probably be excessive to take a supplement that has 100% of your RDA. And so that's just a general recommendation. When you're looking at supplements, you have to factor in your food. Don't take over 100% of what's needed.
That makes great sense. That's great advice. All right, let's shuffle on over to vitamin K.
Yeah, vitamin K. That's a big one, especially now. I hear so many people talking about vitamin K.
Yeah, well, I would love, let's get right down to it. What does the evidence say? Should people be supplementing with this? What is the role of vitamin K? Gosh, they like to use it as this on-off switch again, but go ahead. You tell us.
Yeah, so vitamin K, again, there's nuance there. And I don't want to get too much into the details, but it's important for you all to know this, is that there's different forms of vitamin K. So stay with me here. There's vitamin K1, and then there's vitamin K2. They have different functions in the body. What we're interested in terms of bone health is vitamin K2. But within vitamin K2, there's two different forms within that branch as well. There's MK4 and MK7. Again, each of these have different characteristics and different ways that they act in the body because of their chemical structure. We're talking about bone health, and so I want to really focus in on vitamin K2 and the MK7 form. Because the MK7 form is more bioavailable and more potent than MK4. So what that means is that you can get away with taking one dose of that MK7 versus a 3 times a day dose of the MK4, for example. Vitamin K is important for bone health because it helps, the way that we kind of phrase it is that it helps the calcium get directed to your bones, right? We already talked about how calcium needs to shift from the gut to your blood to your bones, and we know that vitamin D helps it get from the gut to the blood, but vitamin K helps it get from the blood to the bone. So this pathway needs to be supported by all of these nutrients, vitamin D and vitamin K2. So let me just stop there and see if you have any other questions.
No, I get it. It's like they took the calcium comes in on A train and it meets the vitamin D on the B train, which takes it into the blood, and then it meets the vitamin K on the C train to help direct it to the bones. Right?
Yeah.
It's this transport system of trying to get calcium where we want it to attach to that nice protein matrix and make our bone nice and strong and hard. That makes perfect sense. Thank you. You did a great job.
Okay, good. Perfect. I like that train analogy. That's a good way to put it.
So vitamin K we need. Are we deficient? Is that something that we need to pay attention to? And how do we know?
Yeah, so when we look at specifically vitamin K2, there aren't standard recommendations of a RDA, for example, that we would see with vitamin D or calcium, because it's such a nuance within vitamin K. But what we generally know is that in the Western diet, we don't really consume vitamin K2. Why? Because vitamin K2 is naturally present in fermented foods. So this would be like the highest form of food that has vitamin K2 is natto. And this is a fermented bean that is a common food actually in Japan. So they consume lots of vitamin K2, but that's not something really we eat over here. And it's also present in some like sauerkraut, but we don't eat that every day. And we're not eating a lot of it to get to a certain level. And so I would again say it's pretty safe to assume that we're not eating a ton of vitamin K2. So that's why we see a lot of folks supplement with vitamin K2 in the MK7 form.
I will say, I know it's about 1 tablespoon of the natto, the fermented soybean, has a recommended amount per day. I don't know how much in the sauerkraut. And it's really interesting that Japan is the only country that has in their recommendations for osteoporosis and bone health, vitamin K2. But they get it more in their diet than any other country, which is
Yeah.
kind of fascinating.
Well, a lot of the studies too about vitamin K2 are from Japan.
That makes sense.
So, yeah.
So, what is there a dosing recommendation? One of the things I worry about is it safe? Is it safe for everybody? Do they need to check with their doctor before taking vitamin K2? Who's it for?
Yeah, vitamin K2, we need to be a little bit more cautious. It's not it's safe for everyone kind of thing. Because vitamin K, if you have arrhythmias and you are on a blood thinner, specifically warfarin or Coumadin, vitamin K can interact with that and potentially not make your warfarin work as well. And that could be dangerous because
Yeah.
then it could lead to other cardiac conditions.
Mhm.
And so in those specific situations, I would recommend, of course, speak with your physician, speak with your provider to make sure that it's safe for you to consume vitamin K2. Thankfully, a lot of folks who are on blood thinners aren't really on warfarin anymore. A lot of folks have transitioned over to the direct oral anticoagulants, the DOACs, like Xarelto, apixaban, those kinds of things. And then vitamin K2 wouldn't be a risk. But if you are on warfarin, then that would be a consideration and a conversation you need to have with your provider.
Yeah. Yeah. So when in doubt, and always better, check with your provider before taking, stuff. I think it's always good to have that conversation with your provider anyway, so they're aware. What does the research say about dosing with MK7? MK7, the preferred form of vitamin K2. What do the studies tell us?
So I looked at all the data. The MK7, or the studies that use MK7, they vary in range. That's what I'm going to say first. So some studies looked at 45 micrograms a day. Some studies looked at 100. Some were at 180 micrograms. So it's a really big range, and it's hard to say that this one dose is what's good for your bones. But the promising thing about all of these studies showed that whether they used 45 or 180 micrograms, they were all safe in terms of not causing toxicity or side effects. And so what I generally see on the market is that, 100 micrograms of vitamin K2 is generally safe. And that's within the doses that has been used in the studies to show positive effects on bone health.
Okay, micrograms, folks.
Micrograms.
Milligrams, that was micrograms. Okay, super. So vitamin K2 can have an important role in supporting bone health. We're going to come up to the next one, which is calcium, which I know you are very knowledgeable about. Tell us about the role of calcium in bone health. We can't build strong bones without it, can we?
No, you can't, right? 99% of the calcium in our body is stored in our skeleton and our teeth. So calcium is essential for bone health. I know people like to say it's not just about calcium, but you also need to focus in on it, because the reality is about 50% of the population, again, are deficient in calcium.
Yeah.
So it's extremely important, but not only for bones. Remember, calcium is important for your muscles, your nerve transmission, muscle contraction, blood clotting. So calcium is essential for a whole host of physiologic functions.
Yeah, absolutely. When people think about strength training and muscle contraction, not just our skeletal muscle, but our cardiac, our heart muscle too, calcium is really, really important in that. But people will often say that, oh, I had my blood tested and my calcium was normal. But you're saying 50% of us are deficient in calcium. That they're not getting the right information there, are they? About their blood?
This is the confusing part. I wish it wasn't the case, but when we check our blood calcium levels, that is not an indication if you are consuming enough calcium or not. And further, it's not an indication if your bones have enough calcium or not. It's saying that your body is regulating calcium appropriately, in the sense that it's keeping calcium in that fine balance between too much or too little, which is very critical for overall health. It's not actually saying you're eating enough or your bones have enough calcium.
Right. Right. Our body works really well at efficiently keeping calcium at the optimal level for all of the functions it does. And whenever it doesn't have enough, it will take it from our bones to keep it at that level. So you
Yes.
don't know if you're getting enough in your diet by your blood test alone.
Mm-mm.
So talk about supplements. We want to try to get food sources possible. What is the way to proceed with that if we can't get it through food?
Yeah, dietary sources is the recommended source to obtain calcium. The leading medical and nutrition guidelines, they specifically highlight with calcium to get it from food first. So which foods have calcium? Dairy has obviously a lot of calcium, but then there's non-dairy sources like green vegetables, bok choy. I really like that one specifically. Kale has some calcium, broccoli has some calcium, but I like bok choy specifically because not only does it have good amounts of calcium, it also has good bioavailability. Um, so those are some sources, right? Tofu has calcium because it's made with a synthetic calcium to firm it up. And so those are the common sources of food with calcium. If you're not consuming enough, which is most of us, then that's when you look at supplementation. When I was diagnosed with osteoporosis, I navigated the calcium supplement aisle looking for something because I certainly wasn't meeting my recommended amounts. And what I found were different forms of synthetic calcium, like calcium carbonate, calcium citrate. Those are the two most common. And they have some disadvantages to them. The first one being that they cause stomach side effects in up to 30% of the people that take it. Stomach side effects like nausea, bloating, constipation, and not to mention that the calcium pills are really, really huge. So, I mean, that's not something that I really wanted to commit to for the next 30, 40, 50 years of my life. And so that's why Scene came about, where Adrian and I created a calcium chew to just get calcium from food, from milk, in a really easy, convenient, and delicious way. So that's how I boost my calcium, right? I try to be conscious about how much I eat a day. I think I eat about 500 milligrams of calcium in a day. And then I eat one of our calcium chews, which has 500 milligrams of dietary calcium to get to my recommended levels.
Yeah, it's great. So best to get it through food whenever possible. This is really what all the recommendations are. But we're here having this conversation because we know that's not always possible. But when you look at different supplements on the market, you kind of saw a gap in how those were causing gastrointestinal effects and ability to absorb it and all of that. So I love your chew as well. That's what I use. I get quite a bit through food, but I always know that I have that either a half or a whole one to make sure I'm getting the recommended amount, which is 1,200 milligrams per day, correct?
Yes, if you're 51 and older, it's 1,200 milligrams. And if you're younger than 50, then it's 1,000 milligrams. That's a recommended daily amount.
And when it comes to supplementing calcium and getting 1,200 milligrams of calcium, if you're exceeding that limit because you're using food sources, there's not really an upper limit per se. But if you're supplementing beyond that 1,200 with an additional 1,000 milligrams of calcium citrate or calcium carbonate, then we're getting risky when it comes to some of the other side effects involving the cardiac, right?
Well, yeah, I think it's important to understand the risks when we're looking at dietary calcium and synthetic calcium. When we're consuming calcium from food, which is dietary calcium, our body naturally knows how to metabolize that calcium. And further, you're only providing that calcium in its free state. It's not bound to any synthetic salt, right? But when you're consuming synthetic calcium, like calcium carbonate, calcium citrate, your body has to work a little bit more to metabolize that supplement. And if you're consuming, like you said, 1,000 milligrams of calcium carbonate, and then you're also eating 500 milligrams of calcium from your diet, it's when we look at the extremes that synthetic calcium can be a little bit concerning.
Mhm.
So I do want to note that, the Cardiac Society specifically looked at this. They looked at, does taking synthetic calcium increase cardiac events? And what they found is that even actually at levels of 2,000 milligrams a day, you're eating 2,000 milligrams, it was still safe. So
Food wise,
food and supplement
food
wise.
and supplement, 2,000 milligrams a day was still safe when it came to cardiac risk.
Yeah. So that's
Mhm.
why I say when we see a concern for that when we're looking at extremes.
I
So if
got you.
you're taking 1,000 milligrams of synthetic calcium, but then you're taking a multivitamin that also has 300 milligrams of synthetic calcium, and then your vitamin D is also co-formulated with calcium,
Mhm.
then that's where I would start to be concerned. And that's why I also like to just look for supplements for the specific nutrient that you're lacking instead of getting like a whole like combination package.
I love that. I think that's really important is yeah, trying to get them individually so you know exactly how much and what amount. Um, Going back to that, many of the vitamin D come with K2.
Mm-hmm.
Would you rather they did it separately based on what you just said than combining the two?
Well, I think if you have just two ingredients, that's easier to keep track of, right?
Mm.
I think the multivitamin approach is a little tricky because then it's hard to keep track of like all the 15 nutrients that are in that multivitamin. But the D plus K2, as long as you're aware how much is in there, then you should be fine. But I think what I find is that patients aren't aware of what they're consuming when they're taking a multivitamin that has 15 different vitamins and minerals.
All right. Wonderful. Anything else you want us to know about calcium?
I think that covered it, really.
Great. Let's talk about protein and protein's role in bone health.
Protein is also essential for bone health. You briefly mentioned it in the beginning. When we're looking at bones, like the structure of bones, right? You can think of it as protein and collagen being the scaffolding for our bones.
Mhm.
And then the minerals like calcium and phosphorus deposit onto that scaffolding to
Mhm.
build strong bones. So
Mhm.
you can't have one without the other. You need both.
Mhm.
Um, yeah.
Exactly. I like to explain that protein collagen matrix gives bone its flexibility and strength, and then the minerals give it its hardness, its firmness, its
Exactly.
solidity. But yes, we need both. We need those building blocks. And
Mhm.
working 30 years as a physical therapist and working with many people who've sustained fractures, every orthopedic surgeon I know who's trying to help someone through a fracture is like, increase your protein for healing.
Yeah.
So we
Yes.
have to have that protein to build strong bones. Are there, when it comes to supplementing, are some types better than the other? What do we want to look for?
There's a lot of different protein powders out there. So I wanted to kind of just outline the differences between a few. You could kind of think of it as animal-based protein powders and plant-based protein powders.
Mm.
Animal-based protein powders are generally considered complete protein source because they
Mhm.
have all of the essential amino acids that our body requires, including the 9 essential amino acids that our body does not produce.
Mhm.
So that's why a lot of folks lean towards the animal protein powders because of that reason.
Mhm.
And then within the animal protein powders, there's different forms as well. So there's whey protein isolate, whey protein concentrate, and there's some small nuance differences between the two. But they are all considered animal-based protein powders.
Mhm.
And then the plant-based protein powders, those are like your pea protein, hemp, soy,
Mhm.
um, and a lot of those, what I've seen is that they're kind of mixed between all of those sources to make it as complete as possible. Because if,
Mhm.
for example, your protein powder is just made from pea protein, it wouldn't be considered a complete protein source
Mhm.
because it's from plants and it doesn't have all 20 essential amino acids.
Mhm.
So that's why your plant-based ones will be mixed with a whole host of those
Mm.
to make it as complete as possible.
Mm.
So it really depends on your individualized taste, your preference, or do you eat animal products, those kinds of things. But the general approach that I take to consuming powders is that you want the simplest one as possible. So turn the label around again, make sure that there's no added sugar that's unnecessary. Colorings are unnecessary for your protein powder. Added sugar, if that's something that you need in order to consume that protein powder, fine, but you don't want that to be excessive.
Mhm.
So just go for the simplest one as possible, the one with the least amount of ingredients.
Right. Really get it in its purest form as possible. At least, it's still, we're talking about a processed ingredient. We want to have minimal processing, minimal ingredients. Is there so there's third-party testing that can talk to us about whether or not that was made with quality standards.
Mhm.
Is there any other testing or something that we should look for in a protein product that would make it perhaps safer for us?
That's generally what I look for, the third party labeling. And then some of these organizations also specialize in testing like sports supplements.
Mm.
Specifically, like NSF, they have a line that looks specifically at sports supplements. So protein would be in there.
Mm.
And so you could get more information that way.
Yeah, some testing includes like banned items that would for professional athletes and whatnot to make
Mm.
sure that it's really a clean product. I'm not
Oh,
sure
yeah.
exactly what that is, but yeah, great idea. All right, how about creatine? Hmm.
Yeah, now we're getting into the other nutrients, right?
Yeah,
Creatine. So I like creatine. I think there's a lot of
creatine.
there's a lot of evidence to support creatine's benefits for bone health, but also other things like brain health. Um, and the other thing with creatine is that we're probably not consuming the recommended daily amounts. Creatine is really found in a lot of foods that have protein, so red meats and seafood and things like that. So if you're consuming a lot of protein, then you're also getting creatine as well. But we look at creatine supplementation if you are looking to support your muscle strength, improve recovery time between exercising. Um, and so with creatine, I look again for the simplest form,
Mhm.
right? Creatine monohydrate is the form that's been studied most in clinical studies. So I look for creatine monohydrate, but it by itself. Again,
Mhm.
creatine manufacturers like to mix it with some other stuff,
Mhm.
but I like just the simplest form.
Yeah, that's what I do as well. I
Yeah.
like just the creatine. So on the protein, I do a whey isolate protein occasionally when I'm not getting
Mhm.
enough. It's a nice kind of fill the gap. I mix it in cold liquids and it mixes better. In hot liquids, it congeals. Opposite with the creatine. The creatine to me, the version that I get, I mix in my coffee. It dissolves completely. I don't taste it. It's just like I don't even know it's there. And creatine is an energy source for muscle.
Yeah.
When I was taking modern management of the older adult class, they really talked to us about how, we know that this muscle loss, bone loss thing goes together as we
Mhm.
become older adults and progress. And if we're not doing targeted strength training and doing things to help maintain our muscle mass, then we're going to see a decline through our lifespan. Creatine can help support our exercise and our strength to maintain that muscle mass. We're going to get better quality workouts that will allow us to give our bones the stimulation they need.
Mhm.
And it is, to me, it has been very, very beneficial for post-exercise soreness and, just recovery in between sessions. And I'm hoping that it has great brain protective benefits along the way as well.
Yeah.
My understanding is it's very, very well tested. There's been a lot of testing on creatine. It's been used and out for a long, long time.
It has, it has. Social media has kind of caught on to it in the last year or so,
Mm.
I think, but the evidence has been there for quite some time. And I just wanted to make a practical note about creatine as well, is that, The studies that looked at creatine showed benefit if the individual was also exercising
Yes.
and engaging in some sort of resistance training. You know this very well,
Mm.
Lisa, right? So you can't take creatine and expect to build muscle without exercise. You have to pair it with your exercise.
On point, 100%. Yes, agree. All right, just a couple of things that we get through here. Collagen, yay or nay?
Really simply, collagen is on like the bottom of my priority list when I'm looking at bone health. Just because if you're focusing in on your protein intake, you're likely consuming the amino acids that make collagen as well. And so, and again, the evidence is not super strong with collagen, so it's on the bottom of my list.
I completely agree. Strontium citrate.
No, I know. I know we talked about this before. Strontium, I have a problem with strontium.
Mm.
It artificially increases your bone density by displacing calcium in your bones.
Mm-hmm.
So it's going to show a higher score when you get your DEXA scan, but that doesn't actually mean that your bones are stronger or that your bones are more resilient. So that is just a fundamental issue that I have with strontium. It's also not naturally present in milk. I'm not naturally present in bones. So why would we want to replace that?
Agree 100%. Boron.
Boron is an interesting one. I hear a lot about it online these days. There is some studies that show that it could be beneficial for bone health, but it's not, again, similar to collagen. It's on the kind of the bottom of my list in terms of the hierarchy for bone health nutrients.
Got it. And then last ones, other popular brands may talk about zinc and copper. Do we need to care?
No. Population health data shows that we consume well amounts of zinc and copper. So if a supplement brand is advertising, oh, this has zinc or this has copper, which is good for bone health, that would be a marketing scheme. It's you're eating enough in your diet.
Fantastic. Are there any independent labs that you like for testing the quality, like consumer labs or anything like that you like to look at for assessing supplement quality?
Yes, I love consumer labs. There's
It's
also
a membership site for people to know. Yeah.
Yeah, and then also there's one called Lead Safe Mama, I think. I know it's an interesting name, but I trust it because what happens is that anybody can submit a sample and they will independently third-party test this sample for heavy metals. And it's just good data to have. So, and it has a good repository of supplements. So that's something that I go to look at, and especially if I'm looking at something for my daughter, I'll go there as well.
Oh, I love it. I love it. That's great. Wow. Well, Dr. Hunt, thank you. This has been a really informative conversation. As always, I learned so much from you. And I like that we can look at the real world applications. Where are we really deficient? What do we need to look at for supplementing? We need to individualize it for ourselves. And we need to have these conversations with our doctors. We shouldn't just take it as a blanket recommendation for taking these supplements. And we need to have appropriate testing when necessary, like for vitamin D. Look for things through food when possible. Look at all of the things we're taking in our vitamins, our multivitamins, our drinks and nutrition, to look at all the areas where we may be getting some of these to make sure it's just right and not too much and not too little. Mm-hmm. We have another conversation coming up with you and your co-founder, Dr. Bitar, to talk about nutrition and our bones. And I'm really looking forward to that. So I hope everybody catches that and stay tuned, because we're going to have another great talk all about nutrition and our bones.
Yes. Thank you so much for having me today. I love your community. I'm a part of it. Thank you so much.
All right. Thank you. We'll see you next time.